22nd, and I call this meeting of the Budget and Finance Committee to order. Today is our final day of hearings for our FY 2025 departmental budget hearings. Our first guest today, we have the Hospital Authority before us. I am so excited. I love all of my departments, but I have a special place in my heart for Metro General Hospital. So I'm very excited to have them here today. And I am going to turn it over to you all. If you could just introduce yourself and you can get started with your presentation.
Thank you, Madam Chair. And fellow Metro Council members, I'm Dr. Veronica Elders. I'm the interim CEO and Chief Nursing Officer of Nashville General Hospital. And with me, I have Dr. Blackledge, who is our interim Chief Financial Officer. We want to thank the Budget and Finance Committee for hosting us today. And we also want to give a special thanks to the Mayor's Office and Metro Finance as well for their partnership. Dr. Blackledge will now read our mission.
Right. Thank you, Dr. Elders, and excited to be here this afternoon. So the mission for NGH really supports the charter. And the real reason that many employees, such as we have several in the back, and then myself, Dr. Elders, that's really the passion that we have for our hospital. I won't read it in its entirety, but I will point out a few things. We're tasked with improving the health and wellness of Nashvillians. And basically the way we do that is by coordinating access and clinical practice. Toss it back over to you to talk about the mission.
All right, so our academic mission, we are the primary teaching hospital of, let me go back. We are the primary teaching hospital for Meharry Medical College. We also support clinical education through affiliation agreements with Belmont, TSU, Vanderbilt, Ball State Community College, as well as Nashville State Community College. If you look at our Nashville General Hospital leadership, we are governed by the Hospital Authority Board, and we have 7 executive positions. I will say at one point in FY 2025, we had 16 chief executive positions, and we are now reduced to 7. I did forget, and I thank Dr. Blackledge for saying that, but I do like to thank our staff that's out in the audience for all of their support and the mission to the hospital.
All right, quick facts, just to share a few. We are a licensed 150-bed hospital facility. We treat patients regardless of their financial situation status. From an operations standpoint, we are 135 years old, so we've been providing healthcare service for 135 years. As it relates to oversight, we report up to the Hospital Authority Board, which is an 11-member board appointed by the mayor and then confirmed by the council. We have some accreditations that we'll talk about a little bit. Most important, I want to point out the Joint Commission, which is the nation's leading accrediting body for hospitals. It's over to your right side of the slide. And then again, the Cancer Center, which has over 80 years of continuous accreditations by the American College of Surgeons. I won't share any others. Well, one more, Leapfrog. Leapfrog is a national nonprofit watchdog organization that focuses on patient safety. So we did earn an A. I just want to make sure I share that. And then I'll pass it off to the next slide. All right, so this is where we get into talking a little bit about who we are. And so we are Nashville General Hospital, and if we consider this at the top, Nashville General Hospital and umbrella, we actually run about 9 top projects that are focused efforts on actually treating the whole patient. So not just coming into the hospital, getting care, not just going to the doctor's office, but we actually provide way more care than that through these 9 programs. Dr. Elders will talk about those in detail.
So what do we do? What are our programs and services? So Nashville General Hospital, we are a full-service hospital. We offer comprehensive outpatient care through 23 primary care and specialty practices across Nashville Healthcare Center at the main campus and 3 other locations. We do that to improve our community access across Davidson County. We have 2 pharmacy locations, the community pharmacy at the main campus and the pharmacy at Metro Center, which is our Nashville Healthcare Pharmacy. We look at food as medicine. Nashville General Hospital operates the state's first food pharmacy program, and we prescribe medically tailored groceries based on the patient's specific diagnosis, such as cancer, diabetes, heart disease, hypertension. And we do this to improve long-term outcomes and reduce readmissions. We have a cancer program, as Dr. Blackledge mentioned, that has offered 83 years of accredited cancer care and is also the second oldest in Nashville. We sponsor a celebration of life, which will be held actually the first Sunday of each year. In 2025, it marks our 17th anniversary of this celebration. We do take care of our homeless population through our all-weather wellness fund. Now it's in its 9th year. We provide weather-appropriate clothing and shoes for patients, especially during the harshest conditions of summer and winter. And our Nashville General Hospital employees, families, and friends contribute to this effort. We support child advocacy leadership. Nashville General Hospital is the co-founder and ongoing affiliate of the Our Kids Center, which is nationally recognized for medical evaluations and crisis counseling for victims of child sexual abuse. In addition, we have an adult sexual assault nurse examiner program, which has been operating for 40 years. This program collaborates with law enforcement, advocacy groups, and the Sexual Assault Center. They also provide services to other hospitals such as TriStar Skyline and Ascension St. Thomas hospitals. Dr. Blackledge.
Thank you. So where do our patients live? As you all serve, we felt that this was very important to put this in front of you and to really share so you can see, feel, and touch where about 67% of our patient population resides based on the zip code. And then you have the numerical representation of where this resides on the map there. In terms of patient caring and treating patients regularly and daily, I just will share that we have about 57,000 plus clinic visits, about 300,000 procedures and tests, and right under 27,000 annual emergency room visits. And these numbers represent our 2024 activity and where those patients resided in the activity for 2024. We go to the next slide. We really get into it at this point to really talk about what the last 60 days for us have looked like. So as we began to reflect and put this together, we felt it was most important, given the changes that have occurred within our organization, that we talk about the last 60 days. The second part of it is we're going to talk about the future. But over the last 60 days, the progress that our team has made, and that's the total team, has been significant, number one. We want to point out 3 different areas. Our relationship with Meharry. We want to discuss that relationship and talk about the professional services agreement between Meharry and Nashville General Hospital. So we have had a collective number of meetings. Those meetings have been fruitful in gaining agreement to charters, to understanding, to inking the revised professional services agreement. Our timeline is such that at the end of this month, we are pins down to move that to the following month of June, to where we sign the actual agreement. We've broken it out into 2 separate governance committees. One governance committee is a joint hiring committee. This group will jointly hire in our providers that service and provide the care. The second committee is the finance committee, established to look at ways that we can align ourselves to save money, to take advantage of opportunities through funding, such as graduate medical education, to define that, direct, indirect, different pots of money. And so that's where we are at this point in time. Our goal for both parties has been to be transparent with our conversation, to eliminate current, future grievances. So we want to address that right away. Before I move forward to the next one, anything on Meharry you want to share? Good.
Well, that partnership, I'm just really pleased that it has grown and flourished just within this last, I'll say even 6 weeks. I did attend the Meharry Board of Trustees meeting last Friday. I was invited to speak and introduce myself to that team, and that is a first in a long time. Dr. Hildreth also came and visited our campus. which he hasn't stepped foot in the hospital in 7 years. So we're very pleased with that as well.
All right, thank you. Many of you are aware and know that we did have a Metro internal audit with findings. And so while we have been responsive to those findings and have provided official updates with action plans, we want to make sure we address that so that you all know that we've responded, we've addressed it, we own it. There are two items that I wanted to really pull out, and this is all about change. So the procurement process, the way it occurred prior to 60 days ago, no longer exists. It has been defined with ownership, approval levels, and a summary document. So we know who has to sign what document. We understand the circulation of that piece. It's a key piece that has been standardized for our working processes. So one of our goals is to streamline and improve all of our working processes. And this is one of them that has made a major difference over the last 60 days. Second to that has been adding digital tools. So DocuSign, which we're in the midst of rolling out at this present time and doing actually some training for each user at this point in time. Yeah, on that.
I'd like to just address the internal audit here while we're speaking, because it was basically financial and contractual impacts. We only have 3 outstanding compliance items left for that audit. One is the legal action for recoupment of the overpaid funds to City Valet, which we are working through the litigation process for that. We also have leadership mandatory education on our new contract management system, which is due by June the 2nd. That is an outstanding item. And then 2 contracts that we need to bring into compliance will be presented at our May board meeting, which is May 29th. All other contracts that were mentioned in the internal audit have received termination notice, and we have ended all of their services.
All right, thank you. The last one that we'll discuss that impacted the last 60 days has been we launched cost containment strategies with the goal to reduce the cost within this current fiscal year. While I won't share and read the items listed before you, the 2 categories that I want to point out that we've really focused on over the last 60 days include our contract labor. Many of you know we have travelers in, we have others in to assist us with day-to-day operations. So we've taken a closer look at our operations and how we can actually streamline that to remove or eliminate some of our contract labor. Contract services, the same approach. We were able to remove some contracts, either reduce or eliminate those contracts and realign those services. And within those 2 categories, that has probably driven our most savings over the last 60 days. More important, we see those savings continuing in the future. And so those are some of the adjustments that we've made as we prepare to go into FY 2026. All right. As we shift a little bit to talk about the future, what does that look like for NGH, particularly as we have recognized what our budget will be as we go into the new year? So there are three items we have listed. One is we have engaged KPMG to assist us with some of our best practices, workforce optimization. Who is offboarding? Who is onboarding? What does the count look like? Why do you need this position? Some type of approval process. Having that ingrained in our organization, this allows us to close and eliminate current gaps. I'm going to talk about growth initiatives in just a minute, but the 2 items beforehand that are listed really assist us with our operations efficiency improvement, conducting analysis regularly to understand our options for pivots that may need to occur, and then to apply some type of method. So that is number 1 for us as it relates to these 2 dot points. The third one is, as we talk about our growth initiatives, so that would be the third one. Looking at how we maximize our existing space within our clinics, providers' work, employees' work, productivity tools, all those things are listed under our growth initiatives. So while you see just maybe 3 dot points, we are focused on delivering task activities that all align to the growth initiatives. Targeted partnerships with Meharry, other partnerships with the community, and also the hospital, the Tennessee Hospital Association. So those relationships are critical for us, and there are many other partnerships that we could explore and discuss, talk through. Lastly, our goal is to review each one of our service lines, the utilization, the performance, and what that future state might look like. So in the event we need to make a pivot, we have the historical information, we are having the conversations, or will have the conversations, and then collectively as a group make some decisions. So now we get to the fun part. So our initial request was 66 million, and please keep in mind this was in February when we submitted our budget. Our modification came back with 60,746,400. So that's 2% above our prior year, which actually equals about 38.2% of our total sources of income. So we wanted to share this pie so you can look at where do our dollars come from. The biggest population of our dollars, the 67.4 million, actually come from our collections. So we have a population of patients that have insurance that we're able to file a claim, receive reimbursement for their care through their insurance provider, and then out-of-pocket costs for those patients that actually pay us. Other revenues we have, about 8 million. We have state funding, about 21 million, and then access to DISH, about 1.7 million. And so this cost collectively, it represents our income at 158.8 million. So let's talk about new beginnings. After 135 years of service, we are committed to patient care, stronger partnerships, and community relations. I think Dr. Elders shared it best, and I said it, but shared it best by a visual of the organizational chart. It represents a leaner and more streamlined organizational structure. We've moved to Cerner. Many of you are aware of that piece of it. So we're able to have some improvements in patient care, enhanced transparency, different financial pivots. But most of all, for the team members that are present in the room with us, we do have a dedicated, empowered, and celebrated workforce. So I had the privilege of going to different hospitals and prior roles that I've worked in, but I can honestly say and share that I've not seen a more celebrated workforce than at Nashville General Hospital. And that's exciting.
I agree. One of the things that I've always shared in my current or previous role as the chief nursing officer, and I've been in leadership roles since 2007, this is the best leadership team that I've ever had in nursing. And so I will say that. And so we are looking forward to the growth that our hospital has and the opportunities that we have to move forward and transform in the future. And we'll take any questions at this time. Yes.
Thank you. Thank you. Thank you, Interim Director Elders. Thank you all so much for that presentation, and thank you for being just such a steady hand to Metro General during this time of transition. Colleagues, I did want to highlight something just for our general knowledge as well as the knowledge of our constituents. Dr. Elders has been at Metro General for 10 years, and before that, she had 17 years at Vanderbilt. She has a Doctor of Healthcare Administration, Master of Business Administration and Healthcare, Master of Science in Nursing, Registered Nurse, Nurse Executive, Advanced Board Certificate. She is highly educated, highly decorated, and has been, again, just a steady hand during this time of transition. So, Dr. Elders, I just wanted to publicly thank you for all the hard work that you have been putting into this. Very pleased to hear about the improved relations between General and Meharry. Both Meharry and Metro General are two pillars of the community. So we're very glad to hear that there have been improvements in that area. And then, colleagues, one last thing I want to share, and then I'll open it up to questions and comments. I was having a conversation today, and it was about an article that was in the Nashville Banner, and the article was based on a new report from Metro Social Services that found that more than 200,000 Davidson County workers earn less than a living wage. Unmet social needs, environmental factors, and barriers to access and health care contribute to worse health outcomes for people with lower incomes. The report reads, across the lifespan, residents of impoverished communities are at an increased risk of mental illness, chronic disease, higher mortality, and a lower life expectancy. The study found that 16.2% of Nashville workers earning between $25,000 and $50,000 do not have health insurance. And additionally, 1 in 5 Davidson County residents experience poor or fair health, which is worse than the national average. On nearly every health-related metric, Davidson County fares worse than national averages. So I was having this conversation about why institutions like Metro General are so important for our community and why it is important for us as leaders to continue to invest in General, because these are our constituents. These statistics that we're talking about are our constituents, and Metro General services everyone regardless of their ability to pay. As a person with insurance, I am a patient in Metro General. I often share how Metro General saved my life 3 years ago when I spent 14 days in the hospital between ICU and what do you call the ER, the ICU, and in the hospital. And Dr. Elders was personally there to help support me, as well as I see Kathy in the audience and some others who personally helped me during that time. So I know firsthand how much care Nashville General gives their patients, and not giving me special care as a council member. That same care that I saw was the care that I saw other people getting, regardless of if they were housed or unhoused, regardless of their status. They were treated everyone with dignity and respect, and that is extremely important. So I just wanted to thank you all again. I'm going to start off with Chair Evans, and then I'll go to Vice Chair Toombs, and then next, Councilmember Johnston, I believe, may have wanted to be recognized. So Councilmember Evans, you're recognized.
Thank you, Chair. And I'll say I really appreciate the energy, Dr. Elders, that you're bringing to your interim role and the leadership you're demonstrating. I know it's really important, and I appreciate that. And I guess as far as one of the questions that I had kind of related to, as you're kind of looking at the organization and, looking for opportunities for improvements and a variety of things, like, could you help us all understand, like on the clinics, the standalone clinics that we support, what is the goal to kind of maximize that investment? Or is the goal to look at, like, is this something that's kind of a sunk cost and maybe we need to do something different? I recall listening to a hospital authority discussion where there was kind of conversation around like the number of patients that were coming to the clinics. And so just was curious on where things stand with those.
Sure. Our outside clinics was initially formed, one, to expand our blueprint outside of the walls of the main campus. Also, if you look at the pie chart back in regards to our funding, one of the things we were charged with, I'll say several years ago, was to offset our subsidy. And you do that by having more commercial patients. We are restricted just a little bit with location and I'll say facility infrastructure at the main campus. And so building those outside clinics was to help us draw more commercial patients in. Really, you look at primary care as one of those avenues to fund and, fill your specialty services. And so we really didn't look at it as sunk costs. I think you kind of look at it as a avenue to build patient trust, care, add additional variety of patients to our portfolio. Do you want to speak about the cost?
Well, I'll speak about the access too, because that goes back to the mission piece. So that's number one. I'll speak about the access, and so that's the purpose of having those clinics outside. Now, to answer the second part of your question around cost, our goal is to continue to evaluate cost. Keep in mind that we're 60 days into reorganizing ourselves in a way that we have regular cadence, in a way that we are educating our leaders just all around us, just immersing ourselves in understanding our numbers and communicating that out to the masses. So understanding that, I think it was the last or the board meeting before last, we did commit to our board that we will be looking at our clinic operations, right? So we'll be coming back to the board, sharing outcomes of the clinic operations reviews.
Thank you. And kind of speaking to that, like when you were talking about communicating out to the masses, like one of the earlier charts you had with the heat map, you know, where you were illustrating kind of like the number of patients and that kind of thing. I remember first term, we got a really good summary of kind of patient care. It drilled down to our district, that level. And I don't know if that's something you would look at bringing back, because it was really illuminating to me to go, oh, 300 people in District 12, you know, have been patients at the hospital. And so if that's possible to kind of come back to the council in the future with something like that, I think it'd be really helpful to see, because it was even out my direction, which is kind of far away, you know. And then the other question that I had for you on the, you know, as the federal government kind of goes down this trajectory of like passing a really harmful budget related to like Medicaid and kind of, you know, the longer term implications around what that will mean for potentially future council bodies, since, you know, a lot of the bulk of the changes wouldn't come into effect until, you know, likely after we're gone. What have you all had any early discussion around kind of first of all, the challenges that we will have with people losing, you know, probably Medicaid access, and then also with some of the other potential changes, you know, what that could look like just with increasing like your patient volume. And it may be too early to have that conversation, but every time I see these stories on the news, I think about us and how we look at patient care and subsidies and things like that. So.
Sure. I think that's something we are going to have to really do a deep dive in the future. I've read those articles too, and how hospitals are having to slash their budget based on research funding and things of that nature. It's really early for, I'll say, Dr. Blackledge and I in the first 60 days. We're looking at other things, but Dr. Blackledge, do you have anything to add?
Sure. Thanks for the question, number one. I call those headwinds, right? So there's a headwind or a tailwind. I'll respond two ways. One is Medicaid is probably 18% of our patient population. So that's probably 2 out of 10, right? The second piece of that is when we spoke about relationships earlier and partnerships. So we are an open book with Metro Finance. We meet with them once a month. Then we have other meeting cadence that are every week. So that communication is constant. And once we see that headwind and once we understand it, we're going to be communicating, right? And so the thing that is important is it's going to touch lives. If this does occur, lives will be touched and we will need to have a plan. And so we will quickly assemble, develop a plan. And our goal and intent is to continue to provide care.
Right. Absolutely.
Thank you both.
Thank you so very much, Chair Evans. Vice Chair Toombs, you're recognized.
Thank you, Chair, and thank you, Dr. Elders, and thank you, Dr. Blackledge, for being here today. I, too, am a patient at Nashville General Hospital. 2 of my children were born there, and that was not by necessity. It's because I believe it's an excellent hospital, and I chose to give birth at Nashville General Hospital and continue to receive services there as well as with the Meharry clinics. Couple of questions. So I was looking through your questionnaire, and I know that you received under the 66 original ask, and you said that you weren't requesting additional funding at this time. Can you go into that a little bit more and why you feel like you'll be able to make up that difference? I know that request was made before you assumed your position, but can you talk a little bit about that?
Sure, happy to start off talking a little bit about that. At this point in time, we are 60 days into changes within operations, to understanding and outlining our needs. And so at this point, we believe that it was not pertinent for us to make an adjustment or make an ask at this point in time. The one thing that I will share that is a hindrance to the organization, I'll go ahead and put it out there, it is our telephony system. So if we were to think about access and we were to think about how we enter into organizations as patients, that would be the one piece that's just readily top of mind. And I will tell you that we are in a discovery mode with our telephony system today. So there's more to come, but if there was, I would just put that telephony system out there.
I also want to add that we felt right now at this time, Resolution RS 2025-1109 granted us a $10 million subsidy to support our operations for FY 2025. And Dr. Blackledge and I discussed it and didn't feel like asking for more since we just received that supplemental request just recently was appropriate at this time.
And you talked about cost savings, and when you're talking about reducing cost, is that resulting in any decrease in medical staff? Because the concern is, quality of care and making sure there's appropriate staffing. Can you talk a little bit about where you're finding those cost savings?
Well, I'll start out by saying this, and then the staff can tell you. I've kind of said it. This is week 9 for me, and I've said it each of the 9 weeks. Currently at Nashville General, we have 867 employees. We had at one point in time, I'll say when I originally started 9 weeks ago, 117 of those employees are leaders. Within 13 were in the executive positions, and 104 were in middle management positions. And so in all honesty, you're asking about, are we looking at staff reductions? I think we have to really look at, are we utilizing our funding in the most appropriate ways? Oh, the mic, I'm sorry. I was trying to look at Council Lady Toombs, and so I apologize for the drop in volume. But we have to look at all of that. That's part of expense management, and salary expenses is a big expense for Nashville General, and we do have to control it.
I may have some more questions later, Chair, but that's it for now.
Thank you.
Thank you, Vice Chair Toombs. In the queue, I have Councilmember Johnston and then Councilmember Ellis. Are there any other members that would like to be recognized? Okay, seeing none. Councilmember Johnston, you're recognized.
Thank you. And I just want to say I so appreciate your hard work. It's been a super challenging time, but I know, and I've heard through our audit folks, just in our internal and also through external, our contracted, there's a massive difference in now than maybe 60 days ago or even further back. So I really appreciate that, and I appreciate the aggressive move towards efficiencies and all that. I wanted to ask, first of all, now that this is up here, because this triggered another question, where are your clinics? And you don't have to say in the council district, but sort of like where in the county do you have these satellite clinics?
So we have one that's at 1919 Charlotte Avenue. We call it our Midtown Clinic. We have one in Metro Center.
French Landing.
French Landing, yes. And then we have one in Bordeaux that's right off Clarksville Highway.
Okay. I'm wondering about, we're talking about cost and all that, but you do have quite a few patients in the southern portion of the county. And I'm wondering as far as access, and there's also people there that I think when you're talking about increasing the number of commercial patients or people that have commercial insurance, I think the accessibility, if we were to look for a location in the southern portion of the county, would be helpful in a multitude of ways. So you're probably looking at that. I just wanted to sort of put that out there. The other thing, when you said Medicaid patients are 18%, have you done any studies or analysis to see what the impact would be with Medicaid expansion if that was to happen, and how that would impact you?
I would hope that it would be extremely positive, but we have not did a feasibility study. But we could probably do a quick look if needed, if you're requesting one.
I think it would be helpful. I don't want you to spend like a ton of resources or whatever, but as we continue the conversation, hopefully at the state level, I think, because you are getting a state subsidy as well. Let's figure out how we can minimize those things, and if it just may help our case. The other thing that and I've talked about this with other people before, I know you have 150 bed capacity and we're not reaching that. We fall well below that. Have we thought about sort of outside of the box ways to utilize that capacity? For example, we have a massive shortage of mental health beds.
Absolutely.
And I think that's something that the state could help with, as well as Davidson County with mental health co-op or whatever, whoever's in that space. I think that's would be helpful. And so I'm glad you're nodding your head. So I'm glad we're sort of on the same page. So I would love to, if I can help in any way with that. The other thing I wanted to ask was sort of along the lines of Councilmember Toombs, but maybe in the opposite way. We did allocate an additional $10 million to you guys. You've done an incredible job. Just I've seen some of the contracts that have been canceled that have been quite expensive. And so I'm wondering if there's, on top of the 60, whatever that specific number was, is there room there for overages? Is there wiggle room? She's asking if you want any more.
Not at this time.
Okay. Okay, I would be remiss if I didn't ask, but thank you, and thank you for your work. I appreciate it.
I do want to share a comment, Councilmember Johnston. Kathy Poole is in the audience, and as we have been looking at growth initiatives, Kathy Poole, that heads up our marketing team, she actually brought that forward to look at the southern part and how we could have some type of presence. So I don't want to leave that just there. I just want to let you know that that's a conversation as part of our growth initiatives. And Kathy just brought that up this past week.
I would love to help with that. I mean, I've been in the South Nashville area for 20, I don't want to say lots of years. Okay. And so I think I've got a pretty good pulse on that. So I'm happy to help if you would like for me to, not trying to interject, but would be happy to help.
So partnerships and relationships within the community is what we continue to say. So we actually appreciate that, and we'll look to connect with you in the future.
And I will add, Dr. Hilden and I have already spoken about the possibility of partnering with the state in regards to mental health beds. We do know there's a shortage. There have been, I'll say, since they closed Tennessee Christian back in the day. And so we are looking at how we expand that, especially as he's onboarding or looking for a psychiatry chair. And so those conversations are in play.
Thank you, Councilmember Johnston. Councilmember Ellis, you're recognized.
Thank you. I first want to say it's amazing that you all are up there. To be young, Black, and gifted is something that I was telling my nieces this morning. And I will be happy to introduce them to you all. But I wanted to ask about the KPMG, what they're doing. Will they be helping you all explore ways to grow the revenue as well?
So not as much on the growing the revenue side, but helping us look at state funding options to grow that piece of it. We have a little bit of work to do internally from the growing the revenue side, but understanding what our options are for state funding if there are other options out there that we're not utilizing today. So that's why I brought up the relationship piece with the Tennessee Hospital Association and then others. So they will be helping us and assisting us discover, research, understand what other safety net hospitals are like in other states have access to. So from that piece of it, and then helping us look at operational efficiencies, look at month-end close, look at our departmental to other departments' communication, setting up standard operating procedures from that, just to give a little insight. Yes.
Got it. That's good. And when it comes to the employees, it warms my heart that you all have a celebrated work environment and the workforce, that they're happy. And admittedly, I haven't, studied line for line the budget that you all submitted. But does that include any pay increases for folks?
So Dr. Blackledge did include a 5% increase for employees, and I'll let her go into detail on what that is, you can, come on now.
No, we did include the 5%. There are further conversations because there is a notable difference, and I do believe it's been called out in prior years. So we want to look at the future and what it might look like to do something different along with the 5% or whatever that year's COLA is. So we want to consider that, and then we also want to look towards the future and how can we create something different. Healthcare is extremely competitive.
Yes.
And so at this point in time, we're not afforded the opportunity to do things different, like maybe a bonus or other things that are based on productivity measures, the budget, patient net promoter score. I mean, those things that are very realistic, and then we must be able to see, feel, and touch those. And we want to have an engaged staff, and we want to reward them. Healthcare isn't easy.
I could not imagine. Hopefully you, we'll see what the impact is of Vanderbilt losing a lot of money. But also, I'll just end by saying thank you all again for minding the gap while Metro, the mayor's office, is looking for more permanent leadership. Hopefully, they'll just stop looking and get you guys full steam ahead. Thank you.
Thank you.
I second that. Councilmember Gregg, you're recognized.
Thank you, Chair. I want to again applaud the work you're doing to heal the relationship between the two organizations. That excites me because ultimately the Nashvillians that we are serving are going to benefit from that improved relationship. You mentioned the 2 joint committees that are in place now. Can you share any other measures that you're anticipating that you might implement to improve the relationship going forward?
So I'll take that one. So I think it's really a partnership in our patient care initiatives and graduate medical education initiatives. So we mentioned the 2 committees, but they're only those 2 committees are only related to the PSA. Now, we do have Medical Executive Committee, and we have Meharry physicians that have been on that committee for years. The repair and we've always been partners with Meharry. So I think it was the 2 heads weren't, they kind of weren't coming together, and we are bridging that gap right now at this time. And so those 2 committees are for the professional services agreement. But we've been partners with Meharry, I'll say the entire time that I've been there. I'm new to this role 9 weeks, but as the chief nursing officer, I work very closely with all of the medical directors from Meharry and their chairs of their residency programs and their students and residents. I will say Dr. Southpaw, who's their provost, we established a relationship upon her first arrival. And so, those 2 committees that were mentioned are just really specific to the PSA. Now, the Joint Hire Committee will continue, and that has been one of the sticking points in that relationship between the hospital and the college is how do we hire physicians, and we are committed to joint hiring moving forward. And we actually have our first joint hire, and we still haven't had the PSA completed. And so we are making strides in that arena.
Well, thank you. And again, we're fortunate to have you doing this work.
Thank you, Councilmember Gregg. Is there anyone else in the queue? Did you want to come back, Councilmember Evans? Councilmember Evans, you're recognized.
Thank you. I just had one last question. There was a lot of energy, the last couple of years around like a new facility. Is that something you're just like pausing that discussion and kind of reevaluating as you all keep pushing forward? Or where do you sit with that today?
I'll say where we sit as an organization is our partnership with the mayor's office and a needs assessment of what the community needs. That's what we want to do first, and then determine our future after that is completed.
Thank you so much, Chair Evans. Chair Toombs, nothing else? Okay. And I would be remiss if I did not also thank Dr. Blackledge for her leadership and her expertise that she has brought to Metro General as well, more than 20 years of experience. And Dr. Blackledge has an executive doctor of science in healthcare leadership degree. She has an MBA as well as a bachelor's degree. So thank you both for your very competent leadership and your steady hand in getting the hospital on track.
Yeah.
Yes.
We'd like to ask our employees to stand and thank them for coming and supporting us
Yes.
today. Thank you all. And with that, that's all we have. Thank you very much for your time today.
Thank you so much. I am very excited to announce that we are 10 minutes ahead of schedule. So thank you all for being effective and efficient, and kudos to the committee. Y'all did y'all big one today, so congratulations. So we are going to call this meeting, I'm going to adjourn this hearing, and then we're going to call up MNPS and the school board.